Hello, it is March 25th, and I'm still here in isolation with Billy, who is trying to take a nap, but I keep waking her up. And we are completing, gosh, I guess it is day 3.5 now on our own. So, COVID-19 update, worldwide 467,594 cases. 21,180 deaths. Here in the United States, we have 65,778 cases, 919 deaths. And around the world, so much of us are dealing with the same thing here. Italy has 74,736 cases, 7,500 deaths. Italy, of course, has been hit particularly hard. Hospitals have been overwhelmed. The kind of like their American College of Anesthesiologists a couple weeks ago posted guidelines on how to prioritize things if, for example, there are 3 patients that are needing a ventilator and you only have 1 ventilator. So who you decide to give that to. And that is frankly, something I had never seen before in mainstream medicine. Italy has a great medical system. One of the reasons that they're being hit hard by COVID-19 is that although they have a good medical system, they're also the oldest country in the world. So that, of course, places their people at high risk due to the age. They have unfortunately had to ban public funerals because they are limiting, or they're banned gatherings. So this includes funerals. Another thing that's happening in Italy that is really concerning, but it's not just happening in Italy, it's happening everywhere, where people in intensive care units and in hospitals are dying alone because they're in isolation. So no visitors allowed. And for people in hospital systems that are being overwhelmed, there are people that are simply dying alone in hospital rooms, and that is horrible. I can say, as a former intensive care unit, nurse, I worked in an intensive care unit setting when I was an RN for my entire RN career, basically. There were times that you would have patients that were in some sort of isolation type setting in which family wasn't allowed in, but as the nurse you were. And I made it a point, and I think any ICU nurse made it a point, that our patients didn't die alone in a hospital room, ever. And I can't imagine people dying in hospital rooms alone in isolation. So that is exactly the scenario that we are trying to prevent in the United States by taking these social distancing measures, bringing that curve down so that our hospital systems don't get overwhelmed, so that won't happen. There was a poll years ago of Americans, and the number one fear that Americans had as a group collectively, the most common thing that we were afraid of was dying alone. And I just, gosh, my heart just goes out to those souls in those hospitals. Spain, 49,515 cases total, 3,647 deaths. They have also gained the distinction of having more deaths than China. And they have had so many people die so quickly that they've actually converted an ice rink there into a morgue. United Kingdom has 9,640 cases, 465 deaths. Prince Charles today, it was announced that he has COVID-19. He is believed to have been contagious since the 13th of March. And of course, the question everyone wanted to know was, when did he see his mother last? His mother being Queen Elizabeth II, Prince Charles, of course, being the Prince of Wales and the heir apparent to the British throne. Last saw his mother on March 12th, which was one day before he was, or is thought to have been contagious. So good news for Queen Elizabeth, although she is isolating at home per protocol and so forth. Prince Charles is said to have mild symptoms and is being cared for at home. His wife, Camilla, the Duchess of Cornwall, is also isolated, and I've heard conflicting reports as to whether or not they're together, but she apparently had tested negative. So I think it is reasonable that the most accurate report is that they are not together right now, although I certainly cannot call them on the phone to ask. So another report that came out today is that Malaysia, which is the country that makes the most medical gloves in the world, has unfortunately cut their factory staff down by 50% as part of their government's COVID-19 response plan. Basically, they're cutting their workforce in half to decrease the number of the population that is out and about and hopefully slow things down there. That, of course, is going to lead to a glove shortage, which is honestly not what we needed right now. So it will be interesting to see how that plays out, long term. So that's kind of what's going around the world right now in terms of COVID-19. I guess my biggest concern right now, I talked about containment yesterday or the day before, whatever day it was. I do have a concern that we are going to have a scenario of two pandemics. The pandemic that is COVID-19, and that is causing so many people to stay home. Like a third of the world's population right now is under some sort of movement restriction. As a result, here in the United States, we are seeing just regular healthcare clinics closing or switching to telehealth, really dialing back how many patients they're seeing. This is for a number of reasons. Clinicians, in many cases, are having to make individual decisions based on their own risk factors and the risk factors of their staff, as well as elective surgeries and procedures across the country are being delayed. And so much of this has to do with PPE. We're all trying to cut back how much PPE, so masks, gloves, gowns, boot protectors, things like that, how much of that we're using, because we're really having to conserve on resources. But we're also trying to minimize the risk of our patients catching COVID-19 by coming into the clinics. Here locally, and again, this is very typical across the United States, we have respiratory clinics set up for acute respiratory ailments, but then we're also not seeing patients in clinic as much because of what I just mentioned. And so I'm worried about this second pandemic, and that is a pandemic of morbidity or health problems and deaths secondary to lack of access to healthcare. And this may sound extremist on my part, but I'm really concerned if everybody is canceling their routine physicals. And I don't mean the patients, I mean the providers. If everybody is, delaying physicals, delaying med checks, delaying routine medical care, what are the unintended consequences of doing that? What are the consequences going to be of not controlling diabetes as well, not really keeping an eye on blood pressure, not catching asthma being not as controlled as it could be, and so forth and so on. And I think that we have to be very careful and mindful of this. I don't have an answer right now. Um, what I can tell you is that I am still seeing patients in clinic once I'm cleared to go back to work. For those of you who have not been following along, I am currently isolated because I had some fever, cough, stuff like that. I have not been tested for anything. I suspect I may have had the flu, although it is, I guess, possible I had COVID-19 or something else. But we'll never know because my symptoms were mild enough. I did not need to seek outside medical care. But the bottom line is, to get back to what I was talking about, I think that this is something we have to be mindful of. I'm still seeing patients, but we are really delaying anybody that's high risk. So if you are in the 60 plus age group, or you have heart disease, lung disease, kidney disease, diabetes, or immune compromise, I am delaying your appointment a little bit. And I think in the short term, that might be okay, particularly if we're doing the lab testing and things like that to make sure that we're monitoring blood work the way that we could. But that does not substitute for sitting down and talking with your healthcare provider about your symptoms, or your healthcare provider asking you about the things that we worry about. What have your energy levels been? Has there been a change? Are you having any symptoms that your blood sugars are running too high, or any vague symptoms of high blood pressure that maybe you haven't attributed to your blood pressure or to, anything else? So again, in the short term, maybe this is okay, but I'm very concerned about, what is the long-term game plan here? And for many places in the country, I don't think that, certainly I think the whole, this is all over by Easter thing, I don't think that that's reasonable in the majority of the United States. I hope I'm wrong. But, what is the end game here? And I think that healthcare providers have to be careful that, yes, we should try to protect our patient population as much as we can. And yes, we should keep COVID-19 patients and folks who are acutely ill out of routine or out of areas that they're going to come in contact with folks coming for well visits and things like that. But there does come a point where you have to say, okay, this has gone on long enough. We have to figure out a way to separate the two, take the most precautions we can, and so forth and so on, so that we don't have this second pandemic, and that being the pandemic of not accessing healthcare and simply having higher rates of morbidity and mortality simply because our healthcare system is kind of being shut down, or our routine healthcare system. Anyway, tell me what you think about that. I'm concerned. Tell me what you think about it one way or the other. Am I crazy? Is that something you worry about too? And then also, how do we fix that? I look forward to hearing from everybody. Good night, and I hope you all have good health.